We will discuss today what are the mistakes Italy did in dealing with the coronavirus which world should not repeat and take lesson from it. This video will be based on a must-read article written on Harvard Business Review. It is written by Professors Gary P. Pisano, Raffaele Sadun and Michele Zanini. The purpose of this article is to make you understand what lessons could be learned from the Italy at all the levels to deal with the unprecedented challenges presented by the expanding crisis. 4 certain points have been derived by the Italy's response amid the coronavirus crisis. Don't be overconfident that this cannot happen to us. We are strong enough to handle this. How come this could affect us? The threat is not smart enough to disturb and shake our foundations. Do not see everything through the lens of skepticism. Even in Italy, when threat alarm bells were rung continuously, policymakers and public saw it through skepticism and did not pay heed to the threat reaching at the doorstep. Second mistake which Italy did was the partial solution means they did half work and half did not. Like they increased the restrictions in the lockdown areas gradually. It should have been a good strategy in normal circumstances, but here it backfired. Consider the decision to initially lock down some regions but not others. When the lockdown announced in northern Italy became public, people did massive migration to southern Italy, which led to the virus spreading to the region where it was not present. In other words, Italy followed the spread of the virus rather than trying to prevent it. It is better to learn from your mistakes, and if you see others performing well, learn from that too and change the plans accordingly. Let's see the contrast of the 2 different approaches adopted by 2 different regions of Italy, since Italy's healthcare system is highly decentralized. Lombardy and Veneto, 2 neighboring regions with similar socio-economic profiles. Lombardy, one of Europe's wealthiest and most productive areas. Till March 27, the number of COVID-19 patients were 35,000 and 5,000 were deaths in the population of 10 million. Lombardy adopted the approach to only test those who are symptomatic. And along with that, only those fewer people were tested who met with the patients. They invested very few investment in proactive testing, home care and monitoring and protection of healthcare workers. Veneto, by contrast, had only 7,000 cases and 287 deaths in a population of 5 million. What made Veneto perform better than Lombardy? What's the answer? Veneto's strategy was multi-pronged. A. Testing of symptomatic and asymptomatic cases early on. B. Proactive tracing of potential positives to largest extent if testing kits were unavailable. They were self-quarantined. C. A strong emphasis on home diagnosis and care. D. Specific efforts to monitor and protect healthcare and other essential workers. Veneto's multi-pronged strategy worked in a way where their hospitals could not get packed with patients, and medical facilities were not exhausted. Veneto significantly emphasized on home care from the beginning. It also very vital to understand that from all of the world the data which is emerging should be gathered, understood and shared. The key lesson to learn out of many that in this chaotic situation, there is no room for wasting time in indecisiveness and being in confused state of mind considering the exponential progression of the virus. Let's evaluate the steps taken by Pakistan amid the coronavirus. Where Pakistan acted well, where Pakistan is lacking. In such a critical situation, the Prime Minister of Pakistan did not come up as statesman how to tackle the crisis. In fact, in his first press conference he was struck in the definitions, either what we are going to impose is lockdown or curfew. He showed disagreement over the lockdown. Very next day the lockdown was announced by the provinces. This kind of uncertainty and indecisiveness must have been avoided. PM announced the 1.2 trillion relief package amid coronavirus pandemic and cabinet approved it on Tuesday 31st of March 2020. Now we need to think how much time it will take to trickle down effect of this approval. As you remember, the head member of Italy said virus is faster than our bureaucracy. On 30th March, Prime Minister said in his speech, we are making a tiger force where the normal civilians can register themselves. This force will work to reach out to the poor families who will be stuck in case its magnitude of lockdown has to be increased in any particular area. Pakistan is in the process of receiving the testing kits and ventilators from China. They are so far not very large in numbers. Pakistan has the population of more than 1 crore of people who are above the age of 65. We may need more than what we are getting right now. The country has performed nearly 15,000 coronavirus tests since the outbreak, according to Health Minister Zafar Mirza. Current lockdown in Pakistan has the exception of medical stores, bakeries and grocery shops. They can remain open till 5 p.m. This lockdown, which has been reinforced in Pakistan, that is daily dying to its natural death by suffocation from 2 p.m. to 5 p.m. since we are the nation who loves to do everything at very last moment. Government has reinforced the curfew specially from 1 p.m. to 3 p.m. on Fridays to stop the people gathering for the Friday congregation. This curfew will remain reinforced on all the Fridays till the lockdown lasts. Government has taken all the top-notch clergies of the country in the loop to build the consensus among the people to offer their prayers at home. An ex-mayor of Karachi and chairman of political party Paksar's Amin Mustafa Kamal has urged the government to strengthen the local bodies in the country to access the poorest people for help. To bring the food at the doorstep of the poorest can only be done by activating the union councils of their respective areas. If you have liked our video, please do subscribe our channel and press the bell icon. To read all the articles used in this video, please see the links in the description.